It started as a dull ache he barely noticed while chewing. By the second day, it had turned into something sharp enough to stop him mid-bite, radiating up through his jaw every time he tried to eat. There was no dentist to visit, no medicine to take, and no guarantee it would ever actually stop on its own. What he eventually did about it reveals something surprisingly advanced about ancient problem solving. And by the end of this, you will understand why dental pain may have quietly shaped more of ancient human behavior than almost any other single kind of injury. Stay through this one, because the actual methods used here go far beyond simply enduring the pain. To understand what a toothache meant to an ancient human, you first have to understand how differently teeth were used and worn compared to today. Ancient diets, heavy and tough, fibrous, and often gritty food, wore down tooth enamel significantly over a lifetime. This constant wear could eventually expose the more sensitive inner layers of a tooth, creating exactly the kind of deep, persistent pain that modern dentistry would immediately treat, but that an ancient human had absolutely no formal way to address. Tooth decay itself, contrary to what many people assume, was not some rare modern problem invented by sugar. Even without refined sugar, certain ancient diets containing starchy or naturally sugary foods could still contribute to decay over time, especially combined with the complete absence of any form of dental cleaning, as we understand it today. Once decay reached the inner nerve of a tooth, the resulting pain could become severe enough to affect a person's ability to eat, sleep, or function normally at all. The first response to a toothache was rarely passive endurance. Ancient humans appear to have quickly identified certain plants with numbing or pain-relieving properties, applying crushed leaves, specific tree barks, or plant resins directly to the painful area. Some of these substances likely contained natural compounds capable of providing genuine, if temporary, relief, discovered entirely through trial, observation, and the willingness to experiment with whatever the surrounding environment offered. Clove has long been recognized for its natural numbing properties, and while we cannot know precisely which specific plants every ancient group had access to, the broader pattern suggests early humans in different regions likely identified whatever local plant happened to share similar numbing qualities, based purely on noticing that chewing or applying it reduced pain, without any understanding of the chemical compounds actually responsible for that effect. Now think about this for a moment. If you had severe, unrelenting tooth pain with absolutely no dentist, no modern pain relief, and only whatever plants happened to grow nearby, what do you think your first instinct would actually be? Search desperately for anything that numbed the area. Try to physically remove the source of pain yourself, or simply try to endure it as long as possible? Leave your answer below, because how people imagine handling this kind of pain often reveals a lot about how far they would go under real desperation. In cases where pain became truly unbearable, some evidence suggests ancient humans occasionally resorted to physically extracting the problem tooth entirely. This was an extraordinarily risky and painful undertaking without any anesthesia, but for someone in prolonged agony with no other option, removing the source of pain directly may have seemed preferable to continued suffering, even with the very real risk of severe bleeding or infection that came with such a crude procedure. Archaeological evidence from various ancient sites has revealed skulls with clear signs of dental intervention, including holes deliberately drilled into teeth, likely in an attempt to drain infection or relieve pressure building inside a severely decayed tooth. This suggests that at least some ancient humans developed a surprisingly deliberate, almost proto-medical approach to dental problems rather than relying purely on plant remedies or simple extraction alone. Diet had to be adjusted immediately once a toothache set in. Ancient humans dealing with significant tooth pain likely shifted towards softer foods that required minimal chewing on the affected side, favoring anything that could be consumed with reduced pressure on the painful area. This adjustment, while seemingly obvious, still required real awareness and deliberate behavioral change during a period when consistent, adequate nutrition was already a constant daily challenge. There is a temperature-related detail about tooth pain that ancient humans almost certainly encountered without any way to explain it scientifically. Exposed inner tooth tissue reacts strongly to both hot and cold, meaning certain foods or drinking water at particular temperatures could trigger sudden, sharp spikes of pain, seemingly out of nowhere. An ancient human suffering from this kind of sensitivity likely learned quickly, through repeated uncomfortable experience, which specific foods or water sources tended to worsen his pain, gradually avoiding them even without understanding the underlying reason why they caused such a strong reaction. Sleep disruption caused by dental pain created a secondary danger that compounded the original problem significantly. Lying down often changes blood flow patterns in ways that can increase pressure and pain in an already inflamed tooth, meaning severe toothaches frequently worsened specifically at night, robbing an already struggling individual of the rest his body genuinely needed to fight off infection or simply cope with ongoing pain. Ancient humans dealing with this likely resorted to sleeping in a more upright or propped position when possible, an instinctive adjustment that modern dentistry still recommends today for exactly the same physiological reason, even though ancient humans would have had no formal understanding of why it actually helped. Chewing, on the opposite, unaffected side of the mouth became an almost universal instinctive adaptation, one that required no teaching or demonstration, since the body naturally avoided placing pressure on an area already causing significant pain. Over an extended period of dealing with a persistent problem tooth, this kind of one-sided chewing pattern could subtly affect jaw muscle development and even wear patterns on the unaffected side. A small but real long-term physical consequence of an injury that, on the surface, seemed to affect only a single tooth. Social and practical consequences extended beyond simple physical discomfort as well. An ancient human dealing with severe tooth pain often struggled to properly break down tougher foods, meaning his ability to fully benefit from certain parts of the group's food supply was temporarily reduced. In a survival context where every calorie mattered, this created a real, if often overlooked, secondary burden layered on top of the pain itself, subtly affecting his overall physical condition during an already difficult period. If this part surprised you, that ancient humans were drilling into teeth to relieve pressure long before any concept of modern dentistry existed, that is worth sitting with for a moment, because it shows just how resourceful ancient problem solving could become when faced with genuinely unbearable pain. Infection following a severe toothache created a danger that extended well beyond the mouth itself. Left untreated, a dental infection could spread into surrounding tissue, and in more severe historical cases, into the bloodstream, creating a genuinely life-threatening situation from what began as a single painful tooth. Ancient humans who recognized worsening swelling, fever, or spreading pain around the jaw likely understood, even without formal medical knowledge, that the situation had become significantly more dangerous than ordinary discomfort. Group awareness played a meaningful role in how dental pain was managed. A person suffering from severe tooth pain was often less able to eat properly, sleep well, or contribute fully to daily group tasks, meaning the wider group likely adjusted expectations and responsibilities for someone dealing with this kind of prolonged suffering, whether through informal understanding or simply because his reduced capacity became obvious to everyone around him. Prevention, to whatever limited extent it existed, likely developed gradually through observation as well. Some evidence suggests certain ancient groups used simple tools like frayed twigs or fibrous plant material to clean between teeth, possibly reducing trapped food particles that could otherwise contribute to decay over time. This was almost certainly discovered through basic trial rather than any understanding of bacteria or decay mechanisms, simply because it likely made mouths feel cleaner and possibly reduced how often severe pain developed. Regional diet differences likely created noticeably different dental health outcomes across ancient populations. Groups relying heavily on very tough, fibrous, or gritty foods experienced more mechanical wear on their teeth over a lifetime, while groups with softer or more varied diets may have experienced comparatively less wear, but potentially different decay patterns, depending on the specific foods regularly available to them. Neither situation was universally better, simply different trade-offs shaped entirely by whatever food sources a particular environment provided. There is a physical detail about ancient dental pain that rarely gets mentioned, and it changes how relentless this experience actually was. Unlike many other injuries that could be avoided through caution or careful behavior, tooth pain from decay or wear was largely unavoidable given how ancient diets naturally functioned. This meant nearly every ancient human, regardless of how careful or skilled he was at avoiding other dangers, faced some genuine likelihood of experiencing significant dental pain at some point during his life, making it one of the most universally shared physical hardships across ancient human populations. Age brought its own relationship with dental pain many overlook. Older ancient humans, having endured decades of dietary wear and repeated smaller episodes of decay, likely accumulated a lifetime of compromised teeth, meaning severe dental pain may have become an increasingly common companion rather than a rare, isolated event as a person aged. This slow accumulation of damage across a lifetime is one of the clearest examples of how ordinary aging itself, separate from any single dramatic injury, gradually increased the burden of everyday physical suffering an ancient human had to manage. There is one more detail worth mentioning before we close. Individuals within a group who developed real skill at identifying effective numbing plants, or who had steady enough hands and nerve to assist with an extraction when truly necessary, likely held genuine practical value within their community. A quiet form of respect earned entirely through demonstrated usefulness during moments of real suffering. So the next time you deal with even a mild toothache, remember that ancient humans faced this same fundamental pain with none of the modern tools we now take completely for granted. They responded not with simple passive suffering, but with genuine, resourceful problem-solving, numbing plants, careful diet adjustments, and in the most severe cases, direct physical intervention performed with nothing more than raw nerve and whatever crude tools were available. And in many cases, that same resourcefulness likely meant the difference between prolonged agony and real relief. If this kind of detail is exactly what you come here for, this channel is built entirely around real questions like this, the specific hardships and solutions that never make it into the usual retelling of ancient human life. The small details that actually shaped daily survival in ways most people never consider. And staying around means you will not miss the next one.